Good morning, good afternoon, good evening, good night. This is the Face Duo. Today, we're going to talk about the 3 things we would never do as facial plastics, or never perform and never get done on ourselves, right?
Right.
Okay.
Yeah, definitely.
Let's do number 1 for you. No, let's do number 1 for me. You do yours. Okay, what's number 1 for you?
Okay, so number 1, it's a really backhanded statement.
It is, I know.
Okay.
You do you.
Anyway, so my first one would be, I would never do any facial implants other than possibly a chin implant. No,
Which you need, by the way. Yeah.
Oh, God.
Yeah.
Yeah, so I wouldn't do most facial implants. So
like
there's
lip?
a lot of different ones. Yeah, exactly.
Okay.
Lips, cheeks, nasal implants.
Oh, yeah.
Jawline implants.
I would do jawline implants.
You need that.
I do need that.
How
Okay.
many syringes of filler do you have?
Yeah. Okay. Well, another day.
Yeah, exactly. So yeah, I wouldn't do a lot of those because they don't really last, and they oftentimes get infected. They can cause a lot of different problems. There's a lot of other important structures in the area. It just doesn't have the same consistency, longevity, and just the overall, effect that we want. So I wouldn't recommend any of those.
I mean, they do last. Like,
Right.
They'll stay there. But nasal implants tend to move quite a bit. And because there's like a intersection at one point, you can extrude the implants whenever there's like an L shape.
Yeah.
Jaw implants, those are usually okay, but sometimes they can cause infections. Lip implants look terrible.
Yeah.
So chin implants look great. So I'm okay with chin implants, but other than that, I just think the other implants they just don't do it. Cheek implants, no. Like, we can just do a little filler.
Definitely not.
Okay, number 2 for me would be Kybella. So Kybella is a fat dissolver. So it's an injection that's injected into the chin area. It can be injected into other areas as well, but it dissolves fat, your body clears it. It's supposed to make the skin tighten around it. It doesn't do that. It's supposed to be lower risk than liposuction. It's not. It's supposed to be, cheaper. It's usually not. It requires several sessions. It's a lot of inflammation. I have just not been, and of course we're biased, right? We see the patients that are unhappy, but I've just not been impressed with Kybella. It was supposed to be this big thing. It ended up being not a big thing. And I've had a bottle that I've never used. So I just would never do.
Sorry. Yeah, no, I completely agree with that. I mean, I think the level of precision is just not really there for Kybella. And so if you're thinking about getting your double chin or fullness under your chin treated, surgery, liposuction is the way to go.
Yeah. Or if you're older and you need something, it might be a lift.
Right. Yeah, exactly.
And number 3, what was number 3? Oh, number 3 is permanent fillers.
Oh, right.
So with one exception, permanent fillers can be okay under acne scars. But other than that, I would never do permanent filler in your lips, in your cheeks, in your temples, any of those areas. Because A, if there's a complication, I don't know if it's dissolvable. And B, if you don't like it, you're stuck with it, right? And they're not going to be there forever, but they're going to be there a really, really long time. And odds are you may not like the way they look as you age with time. I don't know.
Yeah,
what do you think?
Exactly. Yeah, I think the fillers that we have that are not permanent tend to integrate, I think, better into the tissues and kind of work within. Our face is extremely mobile. It moves around a lot. And so things are not necessarily consistent. Things fall, things, switch around. And so if you have something that's permanent, that's there, that doesn't really integrate into the tissue as well, I think it can become problematic. Yeah, definitely.
All right. If you have questions about what you should do and shouldn't do, give us a call. Send us an email, visit our website, and drop your questions below. We'll see you next time.